Klinika je Visage. Největší klinika estetické a preventivní medicíny a plastické chirurgie v Česku a na Slovensku. 4 města, 5 poboček, více jak 300 služeb, 40 špičkových lékařů, nejvyšší získaná hodnocení v nezávislých recenzích a hlavně více než 30 000 spokojených klientů ročně. Klinika je Visage. Krása v rukou profesionálů. Klinika je Visage. Největší klinika estetické a preventivní medicíny a plastické chirurgie v Česku a na Slovensku.
1, 2, 3, test mikrofonu. Raz, dva, tři. Test zvuku. Zvukový test. Raz, dva, tři. Test mikrofonu. 1, 2, 3. Zkoušíme zvuk. Mělo by to být všechno už v pohodě. Super zvuk.
Úplně krása, děkuju.
Skvělý.
Yes Visage je krásná a vždycky, když sem přijdu, tak se cítím tak jakoby v nebi.
To jsou věci, které tady Yes Visage všechno má, funguje a podívejte se.
Klinika Yes Visage je pro mě opravdu synonymem profesionality.
Má dobré jméno táto klinika, já se těším a velmi jsem zvědavá ještě i na tu novou kliniku.
My muži, my potřebujeme vidět kolem sebe krásné ženy.
Popřál bych aspoň dalších 10x10.
Ať je stále stejná a svá a ať nezapomene, že je tu pro lidi.
Krása, to slovo se na klinice estetické medicíny nabízí a pro mě je krása sebevědomí.
Hodně zdraví a tím pádem hodně krásy na dalších minimálně 100 let.
Klinika je právě Lucie, potažmo, takže já bych Lucii popřála, aby byla dál takhle sama sebou, aby byla takhle nezávislá, silná žena.
Minimálně další desítky let úspěchu.
Aby těch prvních 10 let bylo jen smělým začátkem.
Aby čo najviac ľudí, kamarátov, susedov, našich spoluobčanov pochopilo, ako dôležité je starať sa o seba.
Takže happy birthday!
Happy birthday!
Klinika Yes Visage. Největší klinika estetické a preventivní medicíny a plastické chirurgie v Česku a na Slovensku. 4 města, 5 poboček, více jak 300 služeb, 40 špičkových lékařů, nejvyšší získaná hodnocení v nezávislých recenzích a hlavně více než 30 000 spokojených klientů ročně. Klinika Yes Visage. Krása v rukou profesionálů. Klinika Yes Visage. Největší klinika estetické a preventivní medicíny a plastické chirurgie v Česku a na Slovensku.
Klinika Yes Visage je krásná a vždycky, když sem přijdu, tak se cítím tak jakoby v nebi.
To jsou věci, které tady Yes Visage všechno má, funguje a podívejte se.
Klinika Yes Visage je pro mě opravdu synonymem profesionality.
Má dobré jméno táto klinika, já se těším a velmi jsem zvědavá ještě i na tu novou kliniku.
My muži, my potřebujeme vidět kolem sebe krásné ženy.
Popřál bych aspoň dalších 10.
1 ml, yes. 1 ml.
Klinice estetické medicíny nabízí a pro mě je krása sebevědomí.
Hodně zdraví a tím pádem hodně krásy na dalších minimálně 100 let.
Klinika je právě Lucie, potažmo, takže já bych Lucii popřála, aby byla dál takhle sama sebou, aby byla takhle nezávislá, silná žena.
Minimálně další desítky let úspěchu.
Aby těch prvních 10 let bylo jen smělým začátkem.
Aby čo najviac ľudí, kamarátov, susedov, našich spoluobčanov pochopilo, ako dôležité je starať sa o seba.
Takže happy birthday!
Happy birthday!
Visage. Největší klinika estetické a preventivní medicíny a plastické chirurgie v Česku a na Slovensku. 4 města, 5 poboček, více jak 300 služeb, 40 špičkových lékařů, nejvyšší získaná hodnocení v nezávislých recenzích a hlavně více než 30 000 spokojených klientů ročně. Klinika je Visage. Krása v rukou profesionálů. Klinika je Visage. Největší klinika estetické a preventivní medicíny a plastické chirurgie v Česku a na Slovensku.
Klinika je Visage je krásná a vždycky, když sem přijdu, tak se cítím tak jakoby v nebi.
To jsou věci, které tady je Visage, všechno má, funguje a podívejte se.
Klinika je Visage je pro mě opravdu synonymem profesionality.
Má dobré jméno táto klinika, já se těším a velmi jsem zvedavá ještě i na tu novou kliniku.
My muži, my potřebujeme vidět kolem sebe krásné ženy.
Popřál bych aspoň dalších 10x10.
Ať je stále stejná a svá a ať nezapomene, že je tu pro lidi.
Krása, to slovo se na klinice estetické medicíny nabízí a pro mě je krása sebevědomí.
Hodně zdraví a tím pádem hodně krásy na dalších minimálně 100 let.
Klinika je právě Lucie, potažmo, takže já bych Lucii popřála, aby byla dál takhle sama sebou, aby byla takhle nezávislá, silná žena.
Minimálně další desítky let úspěchu.
Aby těch prvních 10 let bylo jen smělým začátkem.
Aby čo najviac ľudí, kamarátov, susedov, našich spoluobčanov pochopilo, ako dôležité je starať sa o seba.
Takže happy birthday!
Happy birthday!
Klinika je Visage. Největší klinika estetické a preventivní medicíny a plastické chirurgie v Česku a na Slovensku. 4 města, 5 poboček, více jak 300 služeb, 40 špičkových lékařů, nejvyšší získaná hodnocení v nezávislých recenzích a hlavně více než 30 000 spokojených klientů ročně. Klinika je Visage. Krása v rukou profesionálů. Klinika je Visage. Největší klinika estetické a preventivní medicíny a plastické chirurgie v Česku a na Slovensku.
Klinika Visage je krásná a vždycky, když sem přijdu, tak se cítím tak jakoby v nebi.
To jsou věci, které tady Visage všechno má, funguje a podívejte se.
Klinika Visage je pro mě opravdu synonymem profesionality.
Má dobré jméno táto klinika, já se těším a velmi jsem zvědavá ještě i na tu novou kliniku.
My muži, my potřebujeme vidět kolem sebe krásné ženy.
Popřál bych aspoň dalších 10x10.
Ať je stále stejná a svá a ať nezapomene, že je tu pro lidi.
Krása, to slovo se na klinice estetické medicíny nabízí a pro mě je krása sebevědomí.
Hodně zdraví a tím pádem hodně krásy na dalších minimálně 100 let.
Klinika je právě Lucie, potažmo, takže já bych Lucii popřála, aby byla dál takhle sama sebou, aby byla takhle nezávislá, silná žena.
Minimálně další desítky let úspěchu.
Aby těch prvních 10 let bylo jen smělým začátkem.
Aby čo najviac ľudí, kamarátov, susedov, našich spoluobčanov pochopilo, ako dôležité je starať sa o seba.
Takže happy birthday!
Happy birthday!
Klinika Visage. Největší klinika estetické a preventivní medicíny a plastické chirurgie v Česku a na Slovensku. 4 města, 5 poboček, více jak 300 služeb, 40 špičkových lékařů, nejvyšší získaná hodnocení v nezávislých recenzích a hlavně více než 30 000 spokojených klientů ročně. Klinika Visage. Krása v rukou profesionálů. Klinika Visage. Největší klinika estetické a preventivní medicíny a plastické chirurgie v Česku a na Slovensku.
Klinika Visage je krásná a vždycky, když sem přijdu, tak se cítím tak jakoby v nebi.
To jsou věci, které tady Visage všechno má, funguje a podívejte se.
Klinika Visage je pro mě opravdu synonymem profesionality.
Má dobré jméno táto klinika, já se těším a velmi jsem zvědavá ještě i na tu novou kliniku.
My muži, my potřebujeme vidět kolem sebe krásné ženy.
Popřál bych aspoň dalších 10x10.
Ať je stále stejná a svá a ať nezapomene, že je tu pro
Ani další desítky let úspěchu.
Aby těch prvních 10 let bylo jen smělým začátkem.
Aby čo najviac ľudí, kamarátov, susedov, našich spoluobčanov pochopilo, ako dôležité je starať sa o seba.
Takže happy birthday!
Happy birthday!
Visage. Největší klinika estetické a preventivní medicíny a plastické chirurgie v Česku a na Slovensku. 4 města, 5 poboček, více jak 300 služeb, 40 špičkových lékařů, nejvyšší získaná hodnocení v nezávislých recenzích a hlavně více než 30 000 spokojených klientů ročně. Klinika je Visage. Krása v rukou profesionálů. Klinika je Visage. Největší klinika estetické a preventivní medicíny a plastické chirurgie v Česku a na Slovensku.
Klinika je Visage je krásná a vždycky, když sem přijdu, tak se cítím tak jakoby v nebi.
To jsou věci, které tady je Visage, všechno má, funguje a podívejte se.
Klinika je Visage je pro mě opravdu synonymem profesionality.
Má dobré jméno táto klinika, já se těším a velmi jsem zvědavá ještě i na tu novou kliniku.
My muži, my potřebujeme vidět kolem sebe krásné ženy.
Popřál bych aspoň dalších 10x10.
Ať je stále stejná a svá a ať nezapomene, že je tu pro lidi.
Krása, to slovo se na klinice estetické medicíny nabízí a pro mě je krása sebevědomí.
Hodně zdraví a tím pádem hodně krásy na dalších minimálně 100 let.
Klinika je právě Lucie, potažmo, takže já bych Lucii popřála, aby byla dál takhle sama sebou, aby byla takhle nezávislá, silná žena.
Minimálně další desítky let úspěchu.
Aby těch prvních 10 let bylo jen smělým začátkem.
Aby čo najviac ľudí, kamarátov, susedov, našich spoluobčanov pochopilo, ako dôležité je starať sa o seba.
Takže happy birthday!
Happy birthday!
Klinika je Visage. Největší klinika estetické a preventivní medicíny a plastické chirurgie v Česku a na Slovensku. 4 města, 5 poboček, více jak 300 služeb, 40 špičkových lékařů, nejvyšší získaná hodnocení v nezávislých recenzích a hlavně více než 30 000 spokojených klientů ročně. Klinika je Visage. Krása v rukou profesionálů. Klinika je Visage. Největší klinika estetické a preventivní medicíny a plastické chirurgie v Česku a na Slovensku.
Klinika Visage je krásná a vždycky, když sem přijdu, tak se cítím tak jakoby v nebi.
To jsou věci, které tady Visage všechno má, funguje a podívejte se.
Klinika Visage je pro mě opravdu synonymem profesionality.
Má dobré jméno táto klinika, já se těším a velmi jsem zvědavá ještě i na tu novou kliniku.
My muži, my potřebujeme vidět kolem sebe krásné ženy.
Popřál bych aspoň dalších 10x10.
Ať je stále stejná a svá a ať nezapomene, že je tu pro lidi.
Krása, to slovo se na klinice estetické medicíny nabízí a pro mě je krása sebevědomí.
Hodně zdraví a tím pádem hodně krásy do dalších minimálně 100 let.
Klinika je právě Lucie, potažmo, takže já bych Lucii popřála, aby byla dál takhle sama sebou, aby byla takhle nezávislá, silná žena.
Minimálně další desítky let úspěchu.
Aby těch prvních 10 let bylo jen smělým začátkem.
Aby čo najviac ľudí, kamarátov, susedov, našich spoluobčanov pochopilo, ako dôležité je starať sa o seba.
Takže happy birthday!
Happy birthday!
Klinika Visage. Největší klinika estetické a preventivní medicíny a plastické chirurgie v Česku a na Slovensku. 4 města, 5 poboček, více jak 300 služeb, 40 špičkových lékařů, nejvyšší získaná hodnocení v nezávislých recenzích a hlavně více než 30 000 spokojených klientů ročně. Klinika Visage. Krása v rukou profesionálů. Klinika Visage. Největší klinika estetické a preventivní medicíny a plastické chirurgie v Česku a na Slovensku.
Klinika Visage je krásná a vždycky, když sem přijdu, tak se cítím tak jakoby v nebi.
To jsou věci, které tady Visage všechno má, funguje a podívejte se.
Klinika Visage je pro mě opravdu synonymem profesionality.
Má dobré jméno táto klinika, já se těším a velmi jsem zvědavá ještě i na tu novou kliniku.
My muži, my potřebujeme vidět kolem sebe krásné ženy.
Popřál bych aspoň dalších 10x10.
Ať je stále stejná a svá a ať nezapomene, že je tu pro lidi.
Krása, to slovo se na klinice estetické medicíny nabízí a pro mě je krása sebevědomí.
Hodně zdraví a tím pádem hodně krásy do dalších minimálně 100 let.
Klinika je právě Lucie, potažmo, takže já bych Lucii popřála, aby byla dál takhle sama sebou, aby byla takhle nezávislá, silná žena.
Minimálně další desítky let úspěchu.
Aby těch prvních 10 let bylo jen smělým začátkem.
Aby čo najviac ľudí, kamarátov, susedov, našich spoluobčanov pochopilo, ako dôležité je starať sa o seba.
Takže happy birthday!
Happy birthday!
Visage. Největší klinika estetické a preventivní medicíny a plastické chirurgie v Česku a na Slovensku. 4 města, 5 poboček, více jak 300 služeb, 40 špičkových lékařů, nejvyšší získaná hodnocení v nezávislých recenzích a hlavně více než 30 000 spokojených klientů ročně. Klinika je Visage. Krása v rukou profesionálů. Klinika je Visage. Největší klinika estetické a preventivní medicíny a plastické chirurgie v Česku a na Slovensku.
Klinika je Visage je krásná a vždycky, když sem přijdu, tak se cítím tak jakoby v nebi.
Ty jsou věci, které tady děje Visage, všechno má, funguje a podívejte se.
Klinika je Visage je pro mě opravdu synonymem profesionality.
Má dobré jméno táto klinika, já se těším a velmi jsem zvědavá ještě i na tu novou kliniku.
My muži, my potřebujeme vidět kolem sebe krásné ženy.
Popřál bych aspoň dalších 10x10.
Ať je stále stejná a svá a ať nezapomene, že je tu pro lidi.
Krása, to slovo se na klinice estetické medicíny nabízí a pro mě je krása sebevědomí.
Hodně zdraví a tím pádem hodně krásy na dalších minimálně 100 let.
Klinika je právě Lucie, potažmo, takže já bych Lucii popřála, aby byla dál takhle sama sebou, aby byla takhle nezávislá, silná žena.
Minimálně další desítky let úspěchu.
Aby těch prvních 10 let bylo jen smělým začátkem.
Aby čo najviac ľudí, kamarátov, susedov, našich spoluobčanov pochopilo, ako dôležité je starať sa o seba.
Takže happy birthday!
Happy birthday!
Klinika je Visage. Největší klinika estetické a preventivní medicíny a plastické chirurgie v Česku a na Slovensku. 4 města, 5 poboček, více jak 300 služeb, 40 špičkových lékařů, nejvyšší získaná hodnocení v nezávislých recenzích a hlavně více než 30 000 spokojených klientů ročně. Klinika je Visage. Krása v rukou profesionálů. Klinika je Visage. Největší klinika estetické a preventivní medicíny a plastické chirurgie v Česku a na Slovensku.
klinika Visage je krásná a vždycky, když sem přijdu, tak se cítím tak jakoby v nebi.
To jsou věci, které tady Visage všechno má, funguje a podívejte se.
Klinika Visage je pro mě opravdu synonymem profesionality.
Má dobré jméno táto klinika, já se těším a velmi jsem zvědavá ještě i na tu novou kliniku.
My muži, my potřebujeme vidět kolem sebe krásné ženy.
Popřál bych aspoň dalších 10x10.
Ať je stále stejná a svá a ať nezapomene, že je tu pro lidi.
Krása, to slovo se na klinice estetické medicíny nabízí a pro mě je krása sebevědomí.
Hodně zdraví a tím pádem hodně krásy na dalších minimálně 100 let.
Klinika je právě Lucie, potažmo, takže já bych Lucii popřála, aby byla dál takhle sama sebou, aby byla takhle nezávislá, silná žena.
Minimálně další desítky let úspěchu.
Aby těch prvních 10 let bylo jen smělým začátkem.
Aby čo najviac ľudí, kamarátov, susedov, našich spoluobčanov pochopilo, ako dôležité je starať sa o seba.
Takže happy birthday!
Happy birthday!
This is our patient. This patient, you know, she is very nice, but as you can see right now, she has general sagginess. I chosen this patient for the first treatment protocol for general sagginess. If you remember yesterday lecture, we will treat her exactly with these indications and with this protocol. I advise you always take the picture of the patient before the treatment and also right after the treatment. Even if the result after is not the final result, but you need it for this treatment, okay, but also for other treatment to demonstrate afterward in case of any litigation that after the treatment the patient was okay. Okay, this is very important. So twice during the same procedure. Okay. Possibly with the same light. The patient always looking forward, yes. 5 projections. Okay, please. Okay. We should start because we have very long. Relax your face. Okay, and take the picture in the same way. In my practice, I always use also 3D camera. It means that I can take objective and the same projection pictures, and the camera put them together to create 3D image. So this is our patient. Come here, please. We already diluted the vial, but probably I will show again how to dilute it because we have 3 patients, so it's not a problem. Please, could we clean first her face, and afterward I will show you the scheme and drawing of my injection. So clean, please. Okay. I use in my office normally chlorhexidine or some other disinfector, you know, traditional. What do you use in your practice? Chlorhexidine as well? Okay. Sometimes we use oxygen perhydrate and also good disinfector. So after this, we start with marking. Remember to mark the patient always in upright position, of course. Is it
okay to take a picture of her? Or?
Yes, I think so.
Okay.
Mm-hmm.
Okay. Just to make sure.
Okay. So, in this case, we will use 4 deep needle injections entry points and 3 entry points for the cannula. So, as for the deep injection points, I would like to explain you how to find them. I will use another color for this proposal. The first one will go to the zygomatic ligament. As I explained yesterday, I prefer to use these deep injections in order to renovate, reinvigorate, reinforce connective tissue, particularly where we have a lot of connective tissue, like in ligaments, retaining ligaments. And one of them is zygomatic. How we will find it? You know, the zygomatic ligaments goes along zygomatic area, which is compound from zygomatic arch. We need also to show in camera, and zygomatic bone. These two structures have a suture. They are connected by the zygomatic suture, and this suture normally it could be also palpated in some patients, like in her, he is skinny, you can palpate it. Otherwise, you just follow the line which passes from the orbital rim, bone part of orbital rim, rim, in just vertically down. So I palpate the zygomatic arch and the zygomatic bone. So exactly here I will put my first deep injection point, centrated the zygomatic ligament. The second point will be in the preauricular area. In preauricular area we have 2 types of connective tissue. We have Lors fascia, which derives from the parotid fascia going to the tragus. So this part called Lors fascia. And right down, continuing Lors fascia, we have platysma zygomatic ligament. These 2 structures are very important in order to maintain the face shape. These are the second. By the way, here I don't go deep, but I go into the ligaments, since they are superficial here. Okay? So the third point will be in the mental area. We have the cutaneous mandibular ligament. This ligament is created by the muscles, depressors of the oral area, in particular depressor anguli oris, and we know it comes here like in this way, and it's like have a fusion with the band of platysma. And normally we find this attachment right 1 centimeter above the bone margin of mandible. Yeah. So this will be our third deep point. And the most interesting, in my opinion, but also controversial deep point is in the fossa canina. Fossa canina. Fossa canina, it's a particular structure. It was studied by different anatomists. Each of them have different ideas. But at the end, if they remember anatomy, we know that here we have a maxillar bone which is covered by different structure, but our concern is the facial artery, no? We know that the facial artery emerged from the external border of masseter muscle. Just clench your teeth. Clench your teeth. Okay. So I feel here. I can palpate and I feel. So it's deep here in this area. Then, doing like this curves, because why we have this artery not straight? Because we open and close the mouth, so the length of the artery should be extensible, so elastic. And so it goes slowly, and in this area, it's very superficial. So that's why when I go deep in this area and I feel the bone, I'm pretty sure that I don't have any vessel, any nerve structure. Anyway, with our product, which is not gel, but it's suspension, so it's liquid, we can easily aspirate. And I advise you, anyway, aspirate. You don't lose any time, but it's safe for the patient. That's why I will put the product here. You say, but in this area there is nothing of particular. Of course, there is periosteum layer rich in fibroblast, which can create me a big quantity of collagen. Sometimes you can even feel some nodule here, but it's not visible. Why I need it, and I also explain to the patient, you can feel sometimes some nodule here. Don't be afraid. It's simply the projection of your tissue I created. So this is my idea. If you feel it, it is not granuloma, it's normal condition in order to create better projection of the tissue. Okay? Any question?
Can we also draw on this patient the points for the forehead? Not for her, but just...
Oh, good question. Good question, thank you. But I don't inject this product. It's possible, but personally, this is my position. I don't inject it in the forehead. Why? We have superficial temporal artery which emerge from this area before tragus and goes up. At the end, it gives a branch, frontal branch, which goes here, up. And this branch easily meet a connect with supratrochlear and supraorbital artery, which goes directly to the eye. So if we have any risk to have vascular occlusion with loss of vision, this is the case. So be very careful. That's what I don't want.
Okay, but there is no, yesterday on the presentation, it was the temporal area.
Temporal area.
Yes, and this point here. So I mean about
No,
this.
no, this point no. The temporal area is delimited anatomically by temporal crest. Here, I take another color. Delimited by the temporal crest, where we have temporal suture, by the way. What does it mean, suture? It means that here the galea layer is so, which cover the bone, is so close and insert over the temporal muscle, so not going deeper, but over the muscle, is this particular anatomy. So the deep fascia here, paradoxically, will be over the muscle, that it's impossible to go from here inside. You can do it if you detach the skin, but it's not our treatment. When we treat temporal area, we don't go here. We stop here, and I'm sorry, it's not topic for this patient. I will explain it later, because it's important to know that we have suture here, we have suture here, and then we have this area where the product could actually goes, but normally when I treat it, I push here in order to maintain the product in the temporal area, okay? But it was just, it is another topic for the second protocol. So we do this. We individuated deep injections point for this patient. And then, as I say, when I use the protocol for the general sagginess in her case. I use other 3 points for cannula injections. Normally, one of them, the superior point, passes in the line, which I call, not only me, like safety line. Safety line comes from external lateral canthus to tragus. Here in this area, there is no particular dangerous structure, so we can easily create an entry point, insert our cannula. And for other procedures, by the way, I always advise to use the safety line to create an entry point for threads or other procedures. The second point will be in pretragus area, and the last one to treat this part of your face, I put normally in the chin area, and we will create these vectors from the first 1, 2, 3, again from here 1, 2, 3, and we will treat also this area. Yes, of course.
Why you put the entry point for the marionette area in the closer to the chin and not before?
For just for my patients, for how they see right after the procedure. Because if I put the entry point, it's more comfortable. Actually.
I normally do like that.
Yeah. Sometimes I do, it depends on the patient. When I put my entry point here, you know, we have some swelling here, right, because of the point. Yes. And they ask me, oh, doctor, what is this? I have even worse. So that's why I decided to put it here. So I create like a smooth jawline, and they are happier. Even if actually it doesn't matter, you are right, we can put the entry point there, but for some sensitive patients I do in different way, but it's possible. Okay, so let's also draw the same on the other side. So we said the first entry point for the needle will be in the line which goes directly in the suture, the zygomatic suture, and goes exactly in this zygomatic arch part. This will be our first deep entry point. The second point, needle point, will be Lors fascia, platysma auricular ligament. The third, the mandibular cutaneous ligament, we said it's the attachment of the depressal angulae oris, fused together with platysma, right, 1 centimeter over the bone line margin, and the last one will be in fossa canina. Here, okay. For the cannula injection, as I said, safety line from external canthus to tragus. Along this line, I try to hidden always my entry points for the comfort of the patient, actually, because some of them, I have an appointment right after the treatment, so I prefer to do it this way. The first one, we will perform vectors, and nobody asked me why I write this kind of vectors. Ask me, please.
Why do you write this kind of vectors?
Because, as I said, the proposal of our treatment to reinforce the connective tissue. So when I put like in this area, first, these vectors follow the vectors of gravitational sagging, gravitational ptosis. It means that if I create some tightness here, first, I reduce gravitational ptosis, and second, when I will use another treatment, for example, threads, I will already find a perfect environment for the thread attachment, for the barb attachment. And as you saw yesterday, the result will be really amazing. Okay, we prepared our patient for the treatment. We can go in the seat, please. We already reconstituted our suspension. We will not show right now because you know it's so easy. We put inside 6 ml of sterile water and 2 ml of lidocaine 2%, and so we are ready. Normally, give me please the syringe with lidocaine, this one. Normally, first I prepare the entry points for the for the cannula injections. I put just some small papula. We can clean this right now because so normally when I treat my patient, I don't leave all this marking, you know, because I have already anatomical landmarks in order to understand where I should put my needle, where I can create my entry point for the cannula. Okay, as I said, give me please another gauze. Gauze. Dry, yes. No, dry, not without. Okay, it's okay. It's okay. So, is it okay for the camera? As I said, the first entry point for the cannula in this line, I put it here and I create only small. Ask her please in her language if she has allergy for anesthesia.
Nemáte alergie na něco?
Alergie?
Na lokální anestetikum nemáte?
Okay. So just a small papula to comfortably perform entry point. First one, the second one, again, small papula. And the last one from here. Okay. And all other. Okay. I advise you to clean very thoroughly every time, because you know it's very safe treatment, but if you put some infection, it's always problem with any treatment. So are you okay? Are you okay?
Yeah.
Okay. So the entry point. And the last one in this area. Et voila. So, right now, I will use the cannula. I like this kind of cannula, 7 centimeter long. I can use even 5 centimeter, but I prefer 7 because sometimes the patient's face is very long and it's easier for me. This is Mirror Soft 23 gauge, 7 centimeter. So, could you please help me? Just maintain in this way. Let me go. Some very simple things like how to perform the entry point. If you do this, a small fold, you insert easily the needle without hurting the patient. Because of course we have vessels here, but if you lift the tissue, you don't have nothing. And the same again here. I lift a little bit and you see it's perfect. I prepare all the entry point in one side and then please give me the syringe 1 ml with the solution of our product, Estefil. Okay, very well. Please go in the left. Probably I need to put down a little bit. Yeah. So because, oh, okay, perfect. So I can dominate her face. Okay, very well. So we have the first one. And I inject in this simple way. Oh. What? A little bit tough. Probably I performed not so good entry point. Use this. Close, please. Okay. And then I advise you to inject very superficially. Look at my cannula. It is so superficial, touching practically the dermis. Why? Because in my mind, the fibroblasts are exactly here in this area. So I release, look, very easily. 1, 2, 7 centimeters. So we have a very long vector, like 0.2, 0.3 is up to you, and it depends on the patient's anatomy, patient's characteristic. The treatment, it's a little bit probably uncomfortable, but not so painful for the patient. 2, this is third one, and again I put here another one, and that's all. The second syringe goes to the preauricular area. Okay. Give me please another gauze. Gauze. Yeah, this is gauze, yes. Okay. We go inside, if I can, or we need probably another time. During the demonstration, it's always, we always have something different. Could you please put it like here? Okay, thank you. Okay. And I treat from this area mostly the lower third. Look here, what do you see? Bruise, correct. Sometimes it happens, what I do in these cases, give me another gauze, please. I just try to press here upward in order to create the pressure. Okay, and meanwhile I continue to treat. Again, 1. It's very easy. I think it's nothing of particular to you. In order to have easier introduction of the cannula, I advise you to create kind of plain surface, so the cannula goes very, very easily. Look here, if you maintain the skin in stabilized position, you can do it very, very easily, gently, okay? And this one is the second syringe. I will ask my nurse to press here, in meanwhile to reduce the bruising. So press like here. And now we go to the mandible area. No. Okay, no, it's not. It's not the day. It's not the day for this cannula introduction.
It's not okay.
Okay, now it's okay. And from this entry point, as I said, Madonna mia, what happens today? Okay. I try to work both the jawline in this way, superficially, and moreover, I advise you to create a kind of even subcision in the marionette line in order to release the tension here and reinforce all this tissue. Oh. Okay, it's a little bit painful in this area. It's very useful to do it very superficially. Okay, and the last drop we will put here. Et voila. So this is very easy. Now I show you the deep injection points. As I said, I have 1 ml, so I have 0.25 to split in 4 points. In this case, I use 27 gauge needle. This one. And we start with the injection. Why I prefer first to use cannula and then needle? Because we have some lidocaine inside, so the injection will be less painful for the patient. So as I said, I follow the bone margin of orbita, I individuate the zygomatic arch, and I go just in this way. I feel the bone. I feel the bone. When I feel the bone, you could even not aspirate here because you know this is a very safe area, but if you want you can aspirate. And I put just 0.25. Okay, and I advise to massage a little bit. So this is the first deep injection. The second deep injection we said in this preauricular area. Normally, having this long needle, I start directly from the platysma auricular ligament, and I feel very tight tissue here, and I inject in this way. Here, please. Okay, 0.25, and I massage a little bit just during the procedure. The fourth point is in the mandible area. By the way, sometimes our patient, they will even have a kind of incision in the bone, so it's a perfect area to do. Again, I feel the bone, it's very superficial here, and I inject 0.25. Okay, I massage. So I centrated the ligament and connective tissue. And the last point we said is in fossa canina. Go perpendicularly, be very steady. Like in this way, slowly, because the patient feels discomfort, of course. When I feel bone, I don't drill, but I feel it. I take with the other hand my syringe and I aspirate. I aspirate anyway, even if I know there is no artery, but I aspirate to be sure. And then in the same position, I inject slowly. asking the patient about her sensation. Ask, please. Sorry. Could you ask, please, the patient if she feels something uncomfortable?
Paní doktorka, jestli cítíte něco?
Cítím bolest. Tlak.
Pressure and pain.
Okay, a little pain, not particular pain. Okay, first of all, you already see fantastic correction because this is already the projection of the tissue upward. And that's all. We repeat the same from the other part. For the in this preauricular area, these ligaments are very superficial. The fascia is superficial, so you just feel that it's difficult for the needle go inside. Because if you go in with needle in subcutaneous tissue, it's so easy, no? You don't feel any resistance. But when you do it here, you feel that it's a little bit uncomfortable. So I try to push here because normally the more time you push, the smaller is the bruising. So here, but actually not. Ask her please how does she feel? Yes, thank you. What, please, could you explain also to me?
Cervical pain here.
Cervical.
Of the other problem.
Ah, okay. Okay. No, this would be the first time.
Jinak všechno v pohodě.
Everything is fine.
Ah, okay, great. So again, the safety line, the entry point for the medium third of our face, and just create some vectors of traction. I call them because I use threads a lot. And because in this way, I already know on my patient they really have the lifting effect. Okay. In this area, normally the cannula tries to go down. In order to put it up, just put your finger before the tip. If you put your finger before the tip, look, the cannula goes up. This is to be very superficial. Okay. So 3, 4. I distribute following my sensations. The first. Thank you. The next syringe, please. Okay. So the second one is here in pretragus area. I love this area for all the treatments. Yes, thank you. Because we have so much connective tissue here that it's very, very useful for creating any traction and lifting. Look, I am very superficial here. Just 1, 2. Again, I put my finger right before in order not to go deep. By the way, another situation when you can encounter doing cannula injection, that if you go deep, you don't control the tip of the cannula, you can hurt the parotid gland. I mean, you can't penetrate inside with cannula, it's clear, but you can hurt. And it's better to avoid, because the patient could feel pain for some days. Our treatment should be very, very comfortable. This is our aim. You feel the sound of septi, which is disrupting right now. It's a very good sign, because we know in this way we will also stimulate lateral regeneration. And the last point for the cannula in the mandible. Okay. And the mandible, let's come right from the first time. Oh, thank you, God. Okay. Treat always the jawline without any problem. And again, I repeat, the artery and the vein is very deep here, so if we are superficial, we can't hurt anything and we can't create any damage to our patient. Please. And then we treat the marionette line, dissecting a little bit and supporting this area here with our product in this way. And the last part of the treatment, deep injection points. Okay. This is a new needle.
Yeah.
Yeah. I use the new needle for the second part because I touched the bone and the needle, you know, loses the sharpness. So we said the bone margin of orbital rim. I go to the zygomatic arch and I put perpendicularly, slowly, and I insert just 0.25. Okay, massage a little bit. Go to the Lors fascia, a platysma auricular ligament. You can individuate it by pulling earlobe and go in this way. Practically not intradermally, but okay.
Make retrograde.
Yeah, yeah, yeah. Then this area, I feel the bone. I go in the bone, massage a little bit, ask the patient to go in my side. Anyway, I always palpate, always. Be more prudent than less. Uncomfortable, I'm sorry. I feel the bone. I create, with the other hand, this steady position. I aspirate, and I wait anyway. Why not? We have time. And then slowly inject. When I talk with my patients in my language, I ask them to explain every particular sensation they can have. We talk together every minute. And I know it. Why? Know why? Because sometimes I inject myself something. And I always feel when I touch the vessel, because you feel particular pain. That's why I always advise to my patient to explain me if they feel something stronger than normal discomfort. And at the end of this procedure, normally I take some antibiotic cream or cream with arnica just to distribute a little. Yes, just to distribute and just to take care about my patient. Could we have some cream? Like,
yeah, I will.
Yes. In meanwhile, please ask me if you have any doubt. As I explained yesterday, this is the foundation. Okay. And you can customize this treatment following the request of your patient or following the requirement of the patient's face.
Doctor, if you were to use volumization with HIV, when would you do it?
I advise you to wait at least 1 or even 2 months. Why? Because I can volumize my patient with Estafil If my patient need to have some volumization, I can do it. But the point is, this volumization is not visible right after the treatment, of course, but not visible after probably 1-2 weeks. Even the patient feels improvement and notice improvement, but the real volume, it's impossible to see. You know, this is collagen stimulation. It's not filler. And only afterward, I suggest to use filler. Otherwise, you can put too much. This is the point.
Any procedure you would do at this point extra to her? Like, can you do anything together in the same session?
In the same session. Theoretically, for example, you can insert threads. But you know, what accounts for me, this is the philosophy of this treatment. The philosophy of this treatment is to regenerate the connective frame under the skin. It means that when I have connective frame, every other treatment I will try to do in my patient will be successful. Why? Because if I have the net already maintaining all other structure, even filler will create better effect and will create tighter shape, more defined shape, because it's so rare that our patient is looking for just volume. Normally they want like modeled zygoma or Angelina Jolie jawlines or the mandible angle. So they want to have shape, very sharp shape. This is the trend of nowadays. But if you prepare the patient before with this treatment, you will obtain better result. And I don't talk about threads. If you put threads after the treatment, 1 session, 2 sessions, 3 sessions, depends on the patient's conditions of the connective tissue, you will obtain the result which lasts even much more. So this is my philosophy. This is my philosophy of Estafil injections. But of course, we are doctor. Each of us has different ideas and can apply this protocol in different way. Okay, how are you? Beautiful patient. Okay, let's take the picture. No. Just remove these small signs. Okay. And we take the picture. I don't give the patient the mirror. Come please here to the door. I don't give the patient the mirror right after the procedure because first I need to take picture. And afterward oh no, already. She has mirror here. Don't smile, please. And anyway, why I don't ask the patient, I don't permit the patient to see the mirror right after the treatment, because I'm thread user. It means that if there any problem, I can adjust before the patient notices the problem. Okay. Okay, I'm sorry for this bruising, but she will have. So, give me the questions, please. And as I said, I don't like to show the pictures right after the treatment, and because you know this is not the final result, but this is result which we expect after 1 to 3 months. Okay. What else? Thank you, thank you, thank you, thank you. Now we have temporal treatment for the patient. I don't know if probably you need to move or no.
Oh yeah, yeah. We can go
to reception, back to reception, and
Okay.
we will bring the other group for the patient.
Okay. But you can see anyway the temporal injection from the TIVU. Thank you very much. Thank you for coming here. Thank you.
Thank you, Elena.
Okay. Okay, so dear doctors, I'm happy to have you here, you as students, and we will treat this beautiful patient, and in her case we will use the protocol number 2 because she has an evident lateral hollowness and also skelettalization of the temporal area. We already took the picture, and I advise you always take the picture before and right after the treatment, even if in this case the treatment will not show particular result, you know, right after, because we only inject. We will expect the real result after some months, probably after some other session of this treatment. So we will treat the temporal area, and if you remember the scheme I shown right yesterday, we will address this area both by cannula and needle deep injection. So why, this again a little bit, why I do both treatment? You, by the way, you can only use the cannula if you feel more comfortable. But since I studied the technique of Dr. Swift, American surgeon, you know, everybody knows him, and I feel that his technique is very safe, and moreover, sometimes I really need to put the tissue up from the temporal fossa. I use this Swift entry point for the deep injection. Just remember in few words the anatomy of the temporal region, which is delimited in the upper part by temporal crest, in the medial part by the bone margin of orbita, and then by the border, superior border of the zygomatic arch. In this area, the temporal area comes up with the temporal muscle, you know. So we don't have a real delimitation in terms of the suture on some structure which obstacle the diffusion of my product. I would like to underline this particular anatomy to explain why putting here the volume, liquid volume, we will maintain this volume right in that area. Because when I use the cannula, or particularly when I use deep injection, I put my finger here and I press in order not to spread the product up here. Because here there is a suture, it's impossible to go up. Here there is the suture, it's impossible to go into the orbita, and here there is the suture again. So this is the suture between bones which block the passage of this liquid or gel. The same for the HA filler injection, by the way. And then I will also treat it with the cannula superficially in order to save some product. You know, when we inject superficially, we use probably less product. But when we use the deep access and deep filling of this area, probably the treatment is more homogeneous and more evident at the end. I like both, and I normally perform both, except the patient who have very slow grade of skelettalization. So this will be our first treatment. No, I will use it right now here. Then we will use other 3 points for the deep injections, and it will be as in the protocol number 1. The second entry point will be in the zygomatic. Just stay like, see, thank you. Don't go there, okay? Okay, in the zygomatic area, and you remember that zygomatic area is compounded by the zygomatic arch, with its lateral, and the zygomatic bone, which is medial and which normally creates like malar area. Both these bones are connected by the zygomatic suture, and this suture indicates where we can find the zygomatic ligament which runs in this way. So in some patients, very skinny patient, you can even palpate this zygomatic suture. But if you don't palpate, you can easily find it by measuring this area. So we delimitate the zygomatic arch, and we just follow or brow tail vertically, or in her case, the same, the bone margin of orbita. So we go down vertically. So here is my sweet point for the zygomatic deep injection. Then we will use the treatment, a reinforcement of this area. The injection will be not deep, but it will target the ligaments and fascia, because right here we have Lohr's fascia, which arises from the fascia of parotid gland. So it's very tough area, for example, for the cannula. Who uses the cannula from this area know that it's tough to go through. But that's why I will use needle, because I need to target exactly the subcutaneous connective tissue. And then this is platysma, the auricular fascia, and you can easily individuate it if you pull the air lobe. And this area is false ligament, or I call it platysma auricular fascia. Okay, here will be our third, so first, second, third point, and the last point. I always treat the area of the mandibular cutaneous ligament. And if you remember, this ligament is created by different depressors of labia inferiori, and also fusion with the band, the central band of platysma. And the exact attachment is about 1 centimeter above the border of mandible bone. So here's my target, to put the suspension and to create more strength of this ligament, because remember, these are a kind of retaining ligaments which maintain the face shape. Okay? Moreover, not in this patient, but frequently we feel this prejowl depression in the bone, and I put the product, creating even some small nodule. Why not? With our product, we're so eclectic, we can create controlled damage. It's not damage, but when I need nodule to project with the tissue, I can create it. I don't advise you to do it right for the first time when you treat your first patient, but when practice, when you will feel how collagenesis you can induce with a certain quantity of material, you will do it. And after this treatment, I will show you my patient who has really a big incision here in the bone. I put a bolus of Estefil, and at the end we have a perfect result. She feels some nodule. Why not? I explained it before treating her. I said, you will feel nodule, but I do it exactly to improve this area with few milliliters of the product. Otherwise, we need to open another vial. Okay, so not for the first time, but sometimes I create some small nodule, and you know they will be resorbable in time. So it's very, very nice possibility to create volume where we need. Of course, I will not create nodule here. No. Why, by the way, even if we have a lot of subcutaneous tissue? Because of the mimicry. The mimicry creates, you know, like this. The muscle just push the nodule up. It could be visible. So in this area, I don't want the nodule. Okay? But in some area like here, where we don't have mimicry, we need only the sharp shape of the mandible line, we can do it. Okay, so this is the right side. In the left side, we will do the same. How we will find this swift point? I palpate the temporal crest where we have the fusion of the bones, and also remember the paradoxical anatomical situation. From the frontal area, the galea, I mean it's very deep fascia, goes to the temporal crest and can't go under the muscle. Why? Because the temporal muscle, it's not the muscle of mimicry. It's a muscle of mastication. It means that different from other mimic muscles, they are, pretty movable. This one, it's impossible to move. We can move the skin, the muscle is steadily attached. So it should be attached, since she should move, create this movement. It is attached here at the temporal crest and downside to the coronoid processus of the maxillar bone. So that's why it should be very, very strongly attached. That's why it's impossible that the fascia goes under the muscle, it goes over the muscle. And deep fascia becomes the part of superficial part of the muscle. So what does it mean? It means that here we have suture, it's impossible to go up. Here we have suture, it's impossible to go medially. And here we have the zygomatic arch superior part. And the technique of Swift is to find this point of the origin of temporal crest. We go up 1 centimeter, and then we go outside another 1 centimeter, and this is the safe point for the deep temporal injection. Why? Because of course we have the superficial temporal artery, which emerges from the preauricular area and from deep and start to go more superficial, and in this area creates a frontal branch. Frontal branch of this artery goes up here and easily create connection with supratrochlear, supraorbital artery. And they are in a very intimate connection with the eye. So it's very high risk of vascular occlusion and blindness. So we try to avoid. But this artery goes all very in higher position comparing with this area. We have some other small arteries in this area starting from the zygomatic area, but when they arrive here, they are already like capillaries, so it's difficult to create any damage. What we can create, of course, it's a big bruising, because you see she has a lot of vessels. It's uncomfortable situation, but we can survive at this. Our concern is to avoid the vascular occlusion. So this will be for the deep point. Then, as for the entry point for the cannula, I always advise you to follow so-called safety line. Safety line which runs from the lateral canthus till tragus. So this line. Why? Again, we have so few vascular and nerve structures here, so we can put our entry point, so we can create the entry point without any damage for the patient. Normally, I put somewhere here, and then we will create other entry point. We said here just deep needle injection. In the zygomatic area, again, I follow the bone border of orbita, and I put my entry point here in the suture between the zygomatic arch and zygomatic bone. And then the last point is near the in the cutaneous mandibular ligament, 1 centimeter above, in the correspondence of the depressor angular oris and medial banda of platysma muscle. Okay. As for the cannula injection, we said she has hollowness of the lateral part, and I would like to create like this effect. It means I mostly will work in this area in order not only to feel it, but also to create traction. Because, you know, here we have tough tissue. It will be easier to create traction from this area. Moreover, I would like to feel this part and create some lifting of these jowls. So we have one entry point for the cannula temporal treatment, one entry point from retragus area for this treatment to feel this area, and then the third entry point, I don't like it because at the end you will feel, a patient will see also a kind of small swelling here. And they all ask, what, I will have this knot. It's only because I will create the entry point for the cannula, and it will some swelling right after the procedure, but afterward, no. And I will work a lot in this way, okay? So I will cross. Believe me, every time we cross lines, we cross vectors, our treatment gives more result, enhance the neocollagenesis. So it seems, do you have any question on the choice of points? Please, come here. So we already disinfected the patient, but right now I remove all the lines. I remove all the lines. Yes. Yes, we have 6 here.
6 here. May I see this? Or you?
No, we will prepare
this new.
The new one. Okay, just it's very easy. No, aspect. Give me 6 ml of water. Yeah. For this second protocol, I use the same dilution. At the end, I have 8 ml. I would like to show you right now, these spheres, these not microspheres, these are spheres of estafil. And why they are of this shape, I explained before, because they are porous, so the water comes easily inside. They absorb like a sponge the water. That's why we have so short time of preparation, of creation of this suspension. So now I put 6 ml of the sterile water inside. Oh, sorry. Okay. 6 ml of the sterile water inside, and I advise you not to put inside air. Okay. So how I do it, just remove the air with this. And then I put 2 ml of lidocaine. But normally I prefer to wait a little bit because of pH difference of two liquids. And we already have another one ready. So it was for the next patient, and we will just add some lidocaine. By the way, this is for the next. We will use this. you can put 2 ml of lidocaine, because I wait to put lidocaine in always till the end, not to create any problem with solution. By the way, you can also not use lidocaine, because it depends on the patient. Some of the patients, they're very sensitive, so I prefer to put lidocaine. And by the way, for this proposal, I first treat the patient with the cannula, okay, distributing solution which creates some anesthesia, and afterward I perform deep injection. It will be more comfortable for the patient. So the first, so it's already ready, and here we have, this is lidocaine, 2 ml. Okay, no, I check because, you know, we will inject in the live patient, so it's better. Anyway, you see this suspension is milky. No bubbles, no deposit in the wall, and the walls are clean. Okay, this is the final solution. We can keep the needle inside, so we can take the product. And now I will create the entry point for the cannula. I normally put some lidocaine for this. Okay, this is lidocaine. Could I have some more lidocaine? Okay, and more comfortable. When the patient doesn't feel a lot during the procedure, he always or she always comes willingly at the second treatment. Okay, so just a small papula in the entry point, one here, okay, another one here, and the third here. Okay, the patient is a very good patient. She doesn't complain. Again, safety line, you don't need to see it because you have anatomical landmarks. You put your fingers and you feel exactly. Again, pretragus area, very easy to individuate. And as for the third entry point, we have the artery, the nerve, and the vein here, but they are very deep. But we go very superficially. Okay. So I will start with the cannula injections. Give me please pink needle, yeah, because this one is too small. Thank you, yeah. I advise you to pinch the tissue so you lift the skin and you avoid to touch any vessel, and safer. No, because you know, even if you have some bruising, it's already a small side effect for your patient. Lift and create small entry point. Okay, and now we start with the cannula injections. Very interesting thing here. First, we see a lot of vein in this patient. We insert our cannula, and I advise you to go very slowly with, look, this twisting movement. I rotate, and then I release without any problem, kind of sausage. You see sausage here, It's not a problem. I just spread. I should put here the finger when I will inject this area in order not to spread the product up, because we don't need, simply not because it's dangerous. It's simply just not to spread it. At the end of the procedure, you will see here sometimes a kind of depression. The patient is worried about this depression. What is it? Exactly, there is this suture which is impossible to overcome for the suspension, but it disappears because now this area will be a little bit with edema, and that's why it will be visible, this suture. I go in this way very slowly because she has a lot of superficial veins. As I said, the problem is not vascular occlusion. The problem is bruising, and I don't want my patient to have any bruising. Like here, when I release here, because I said here it's possible for the material to go up. Here impossible, here also. The only place is here. So I put my finger, I press, and I release. And I do it different times. I overcome this vein, you see, and I pray not to hurt her. Okay. And again. Sometimes you even see some sausages created. Don't worry, it's nothing of risky. Ask me your questions, please. Et voila. And of course, I massage this area. You see the product. Massage in this way. So it is all inside. Look at the beautiful correction right now. Sometimes you even don't need to put the deep injection. But today we will do, just for educational proposals. Probably I inject just some water, not to overdo, not to overtreat.
With this we can work the posterior temporal fossa too?
No, well, why do you need to work?
To this?
You mean to lifting effect?
Lifting effect.
I'm not a fan of this technique.
Okay.
You can do it for your patients. But I saw, as dermatologist, by the way, some cases of hair loss due to the probably pressure on the follicles. And I try to avoid, because you never know. You never know if the patient fragile for this reason. Okay, and I already created the entry point. So the nice thing of Estefil for the temporal correction is that differently from the HA filler, even with very low G prime, it's so easy to distribute and to create even deposit of the material in the subcutaneous tissue. This is very nice thing. Of course, being a collagen stimulator, we will wait for the results, for the final result. Okay, so could you please put down this? Remember, you should always walk, I mean this part. Okay, thank you, yeah. No, I think it's okay. So you should always walk comfortably for you, no? So just move the patient, move the bed, and then we go to this area. Do remember that our target in this area are fibroblasts, and the fibroblasts are in the dermis. That's why when I treat here, give me please a clean one, thank you. When I treat this area, I go very superficially. Look, you see the cannula, the tip of the cannula, okay? Sometimes, and I will show you, I go again to the angle here because I want to enhance the angle, like Angelina Jolie, something like this. So I put my product. For example, here in this area, we have difficulty. Why? Because we have parotid fascia, which is adherent to the skin, particularly in the not young patient. And the cannula tries to go down, and it's possible to hurt even parotid. Hurt, I mean, just creating some pain. We can't enter into the parotid through parotid fascia, of course, with the cannula, I mean. With the needle, yes. So how can I overcome this area? I tract the skin, I stabilize the skin, and then I just push, putting my finger right before the cannula tip. So the cannula in this way, look, goes up, and so I can do what I really need to do, releasing very small quantity. By the way, you see me with a 1 ml syringe. Why? Because in this way I release very small quantity and the distribution will be homogeneous even without any problem. And I remember she has also here, so I go my finger before the tip. There is fascia, so I do this movement like screw, and then I deposit my product inside. So that's all from the second entry point. So we go to the third. In this case, we will treat the jawline. We already prepared the entry point. And strangely, I'm already inside. Normally, during demonstration, it's more difficult. I follow the same idea. I go very superficially. In this way, look, touching the skin, the dermis. I go to the angle, and I even can put some more product here. It's up to your sensitivity and aesthetic test when you use this treatment. Again, I see the vein. When I see the vein, I go just a little bit deeper in order to avoid. And then I remember that here she has a kind of incision in the bone, and I go right there, and I will deposit some more product. You see me always with this finger in this around, because I want to see, of course, but also to touch. Because when I touch, I feel also the depth when I am. In this way, I will create some more tissue here, and then just continue to feel the hollowness, her lateral hollowness. Okay? Et voila. So we did this treatment with the cannula. So we start now with the needle. Oh, thank you. You're perfect. So the most scaring point, by the way, we decided not to fill, I just fill with water. You know why? Because I think it's already enough for her. But I want to show you how to perform. Can we have just water, one syringe with water? Yeah, only 1 milliliter. As you remember, we have 1 ml, because 3 ml for cannula injections in 3 entry points. It means 1 ml for each point. Just to remember, to have schematic view of the situation. So we have last 1 ml for hemiphase for deep injections. For entry points, it means 0.25 ml for each needle point. Yeah, we can use this one. So as I said, just because this patient is particular, but normally I always perform also deep injection. How can we find the point? Now, I feel the temporal crest. I go 1 centimeter up. I go 1 centimeter laterally, and then look, you should be very steady. This is your point. I check the vessels. I see veins here and here, but I go in between. It's uncomfortable sensation for the patient, but now not, because I put already some anesthesia. I feel the bone. I don't drill my bone, but I feel it. I am sure that I am in the bone. I fixate my syringe with the left hand. I aspirate. There is no there. We know that all the vessels will go higher or in lower position, but anyway I do it. And then, as you remember, I put my finger here in order to maintain the product into the fossa, and I just release to 0.25. It's burning because it's sterile water. And then I just press a little bit. So this is a safe point. I was very scared to perform this deep injection in the temporal area. But after studying this technique, actually after again looking to our textbooks, I understood that probably it's one of the safest. And anyway, aspirate. Differently from the HA fillers, we can aspirate easily. We never have obstruction of our needle, so it's very safe. Okay, so we have 0.25 more now, and what we can do? We can do what we want. We can put it where we need more. In her case, in this area, I can enhance more the angle just with the needle injections. First, anyway, I will treat the traditional points. We said the zygomatic point, which is here, just take your finger, go vertically, you feel the zygomatic arch, and in between, in this suture, you perform this deep needle injection. Normally, it's not particularly uncomfortable. I feel the bone. By the way, in different patients, the depth you see is different. In her case, it's very superficial. The bone is superficial. So again, in this area, we don't need to aspirate. Remember, McGregor's patch, and just put 0.25. 0.25. And press. So you will distribute. Do you have any question?
No, just
ask, please. I am eager to have your questions. Okay, and then we treat the preauricular fascia, Lohr's fascia, and the platysmal auricular fascia. Both here, they have an important. They play an important role in the maintaining the face shape. Go into, not deep, and I feel that I'm in the connective tissue. As I said, probably, by the way, in this way you will also already treated these preauricular wrinkles. They are not so nice. But in this case, I change also the direction of my injection, because I want to enhance the angle. So I go from this area deep. I penetrate into the fascia. I can easily feel it because I pull the airlobe, and I spread more product here, enhancing the area. I leave only 0.25 for the last deep point. Okay, just massage a little bit. And that's all. And the last point we said here, we remember depressor anguli oris, platysma band, 1 centimeter right here. Sometimes I feel, if I feel the incision in the bone, I go right there. Okay, it's with age. You are all too young to have this incision. Okay, here I feel the bone and I deposit. The patient is perfect. Okay. Again, I just spread a little bit. Okay. But in some cases, as I mentioned before, I leave small nodule oppositely, intentionally. Okay, so we finished the first part, the right side of her face, and we go to the left. Again, I already put lidocaine here, so we can directly start already, it seems. Ask her if she feels something.
Tady ten vtych na ten spánek, tak tam
Yeah, where I injected where I injected water because it's burning, you know. No, I feel if he feels here.
Jestli na té straně cítíte něco, co vám...
No, because I already injected it, okay.
Co vám tam paní doktorka píšla.
Okay.
Ne, necítí. She doesn't feel anything.
Yeah, no, because I already... First the entry point. Oh, sorry. So, the safety line. We see the line. We create an entry point. I pinch. I pinch also here, and I create another entry point. And I pinch here. Already have small bruising, and again I create an entry point. Now I start with estafil injection in the temporal area. Oh, this here. That's why I prefer men patients. They bald frequently.
Or you can shave it here.
Yeah. It's not sterile procedure anyway, but I don't like to have a lot of hair, yes. The male patients, they are perfect. Again, just this delicate movement, crossing your fingers, not to touch the vein and not to create any bruising, and just distribute it. Okay. You will try, by the way, if somebody have the same technique. I can't work without finger, because I even feel the quantity I put inside, and for me it's very important. So I'm sorry, probably I hide the exact trajectory of my cannula, but it's okay. I try to do differently for you. And the last trajectory, last vector will be near the hairline, and it means that I will try to put my finger here to block the diffusion of the material. So I just put in this way a little bit steadily and release what. Okay, and distribute. Distribute in this way. Very nice correction, very homogeneous, very homogeneous. Remember me to show you the pictures of my patient. She sent me yesterday, so I'm very happy because in that occasion, with this procedure, I created bruising. So I was a little bit worried, but everything is okay. And no, just to show you, when I put a lot of product in one place, you can totally change the jawline. Normally I do it in the jawline. Okay, the second entry point near the tragus. Okay. Okay. And we decided to enhance her or here we have a lot of connective tissue. So in order not to bend your cannula, it's so fragile, I create a tunnel. So I create a kind of fourth passage for my cannula, and it will go exactly where I want. And Dr. Beata knows, because she is also a thread user. Sometimes different techniques helps us to learn other techniques. Okay, again here I go very superficially. I want a little bit painful, of course, because when I dissect tissue, she could feel some pain. That's temporal, because we have lidocaine. That's why, anyway, even some doctors, like Dr. Bautzer, for example, he prefers without lidocaine. I can understand. And I can do it in some less sensitive patients, but mostly Italian patients are very sensitive. Very sensitive.
A bit hysterical.
Okay, you see
so
some
in case you don't use lidocaine, you add more to...
Absolutely correct, yes. The solution should be the same concentration. The question only to have a little bit different composition. So when I treat from this entry point, I go to the other side. Here, as I said, we already have small bruising. Again, go superficially. You should see the cannula.
Superficial.
Go to the angle and enhance. Hands as much as possible, and she will obtain a really nice result for her jowls. It will be lifted at the end. And then again, I see anyway some hollowness still, because even if this is not a final result, but it's already an idea how our patient will look. Okay? Then deep injection. Yep. First we said we need one with water.
Yes, this.
Yeah. We can use also saline, but we don't have right now, just to not lose time. Sorry. Again, orbital rim, crest, 1 centimeter up, 1 centimeter in the lateral part. Look at the vein. Sometimes to find them, just distend the tissue in this way. And in her case, she is very fair, clear skin color, it's easy. But for example, when the patient's already with a tan, it becomes difficult. So take the syringe steadily. This is the point, 1 centimeter, 1 centimeter. I do this, I go perpendicularly in the bone, I feel the bone. So I don't push, of course. I take my syringe, I aspirate, nobody could stop me. And then I just put 0.25. Less or more. Okay, I don't want to. Okay, and the product from here, as explained before, is in the muscle. There is no fascia under the temporal muscle because it's in the bone. So it will descend like following gravitational force and will feel all this temporal area. I mean, you know. Moreover, we did also this part. It's nice treatment. Okay, so the next deep point is in the zygomatic area. I repeat again, we individuate the zygomatic arch and zygomatic bone, which is medially. I touch the orbital rim and I go directly down This is my point. Again, I touch the bone, it's very superficial in her case, and I release 0.25. And here, massage a little bit, so you spread also the product along the ligament, and then let's enhance again this area. I go first to the Lors fascia, it's here. Sorry. A little bit. And she also, from the first session, will find improved the wrinkles here in 1 month already, first. And then, as we said, we want also to enhance platysma auricular fascia. And we go from this area, and I also try to enhance the angle. This, I love needle to inject. No, not my patients, but me, yes. Because in my opinion, needle is very precise, particularly when we have this product which is pretty safe. Again, down, platysma band, 1 centimeter up. We have, again, bone, and we put slowly, because you know the suspension has a little bit acid pH, I think. That's why it could burn. And massage a little bit. That's all. Now we will massage, not because this product should be massaged, but to give more comfort for the patient. We take some, to remove this. No, remember this particular anatomical feature I showed you, that this artery, frontal artery, is connected to this artery who goes directly to the eye. It means that in my practice, I will never use filler here in the front. You said, but you can use it here. Okay, but imagine if the patient have some anatomical particularity. How many times? Probably only 1%, but if, you know, you risk so important side effect, irreversible side effect, it's not for me. So I don't treat, I'm sorry, even if it's very diluted. Some of doctors asked me today or yesterday, I don't remember, if she diluted very, very much. In my opinion, we can't risk. We can't risk. Because in this area, even small quantity of microparticles, who knows? Who knows? Probably they can create anything. No, I don't risk. So that's why, or you did the treatment till here, deep or with cannula, or you can choose another device for this treatment, for the wrinkles of the, what do you use normally?
Botox.
Botox, this is the base. We can't live without Botox. But what else? Threads. Threads are perfect. They don't have any risk to occlude any vessel. Nothing. So use threads. The threads you prefer. That's all. Do you have any question?
What about neck treatment?
Very good. Neck treatment with high dilution is perfect. The question is like budget of the patient, no? Because sometimes the patient have no money for 2 vials. How can I do? Since the neck skin is very, very thin, it means that we can stimulate the collagen production even with very few quantity of the product. So for the low budget patients, I treat the face and I just put 1 or 2 ml of sterile water and I treat also here. Of course, the result will be much better if you put a lot of product here. But anyway, you should dilute it and you should be very careful with the distribution. Why? Because differently from the face, where we have a lot of subcutaneous tissue, for example, this patient, actually she also has some, but there are some patients without subcutaneous tissue. It means that even our product is so easy to penetrate through the subcutaneous fat. It's not the same situation if you put it adherent on the muscle, so under the skin. But when we have very, very skinny patients, there is no practically subcutaneous tissue, particularly when they are old. So be careful. You can do it. Dilute it a lot. I mean, like at least 12 or even 15. Why not? No problem at all. Because what has matter, it's not the quantity of water. The point is the quantity of the product. If you dilute it in 20 and you put 10 milliliter hairs and 10 milliliter hairs, anyway you put whole the vial, but distributed much better. It's for the safety. Personally, I love to work with concentrated product when I need to create some tailor-made feature in the patient, when I need volume, when I need, as I said, to create probably some nodules in specific depressed area. But when you are beginner, please use indicated dilution for the face and a bigger dilution for other sensitive area. Let's ask the patient to stand up, and as I said before, we should always perform post-treatment pictures. It's for you, it's not for the patient. The second picture is for you, to protect yourself. And if, could you please close? Don't smile. Serious. Five projections. Okay, and I would like to show you also, because the words are not enough. We should also have facts. And I will show right now with this particular pattern of implantation, of injections. We already have, look at this improvement of your jawline. Ecco. Oh, Dio mio. Oh, also Monopoly. Let's just 5 seconds, sorry. Salta video. Salta again. Okay, this one. So, you can see how the jawline becomes, look, from here to here, straight. And the preauricular area, look.
Yes, the wrinkles.
Yeah. So the patient, even if she look in the mirror, probably already sees some improvement. And this will be the final result after 2-3 sessions in her case, because she's not young. Final result will be exactly, I will show you my patient. I made bruising in the temporal area, so I was so scared. I call her the day after. But look, I created, because this patient, she has a big incision here. You can put the finger inside. And I put like 0.5 ml only in this area. Look what a wonderful result. Yeah.
The hollow.
Yeah,
beautiful,
yeah.
Beautiful. But like here too.
In the mandible?
Yes, of course I did with the cannula, but here I put the needle.
Yeah.
The needle, look, she is very beautiful herself, also here.
Claro,
Look,
claro.
she's skinny, so this is not jowls. This is the bone depression. That's it. It seems like jowl, but it's not jowl, and you can feel it. It becomes perfect. Yeah. So you always need to study not only the skin but also the skeleton, the bone part. So you will perform beautiful treatments. Because most of you, I also saw some comments from you as a doctors. You have a good aesthetic sense. This is the point, to have good aesthetic sensation. So you will create, like you created yesterday. You showed this case was amazing, really compliments.
Thank you.
So guys, questions, ask me everything.
How long the results?
How long?
The result.
After one session with previous product, I used Sculptra. The result was visible after at least 2 sessions, sometimes even 3 sessions. But with this product, believe me, as you also demonstrated, after just this session, the patient will have good aesthetic result for weeks. Probably right before the second session, she could feel something. So you repeat the session. And the final result, due to the enhancement of collagen, will be after 2-3 months. You know, the time we need to have good, a big amount of collagen, new collagen.
And were repeated all sessions? What, after 1 year or?
It's up to you, up to the patient, of the patient lifestyle. Because you know, if the patient is smoker, just 50% of the result throw in the in the toilet. So if the patient healthy lifestyle, good diet, good quantity of proteins. For example, when patients who follows vegan diet come to me, I don't treat with collagen stimulators. If the patient doesn't get supplements, amino acids, whey proteins, or something like this, because it's useless, you know. It's disappointment for you as doctor, yeah. We should go. Okay, doctors, it was great to have you here. Thank you. Thank you very much. Thank you.
Thank you so much.
Can I take a picture with you?
With pleasure.
Amazing, I loved it.
the first thing we do with our patient, pictures. Don't smile. We need pictures to check the result. Five projections in order to have every okay. And moreover, as I already said to other doctors, by the way, when you are follow the doctor, of course you don't see what they translate in the video, no? You don't see.
There?
Yeah.
Yeah.
Ah, you can see.
Yeah.
Okay, so probably you already know that I advise you to take the picture before the procedure and also right after the procedure, because there are different situations when the patient could do something at home and complain that it's your fault. So be careful, protect yourself. So we it's not okay, but and okay, this young patient, handsome man, yeah, has a problem with atrophic acne scars. It means that we need to hurt him a lot today. Why? Because in this case we need to subside and then to inject directly at the bottom of the scar. And already crying. No, not yet. Okay, so thank you very much. He has this temporal region alterated a lot, and particularly we see here in the zygomatic region very deep scars, very deep scars. The same also here, but less visible. How I perform the treatment? My patients for acne scars, they normally have total trust in me. It means that I can do what I want, even if it's a little bit hurt, you know, because we use. Can we put here something like paper? No. It's okay. We can. So, I will use the needle directly under the bottom of the scar, but I would like to create like a smooth surface with, anyway, cannula injections. And I will show you how can we use the cannula. We see mostly two areas to treat. So temporal area and also like cheek area. To create a safe entry point, I mean when we don't have any particular vascular or nerve structure, I always advise you to remember the safety line. The safety line which passes from the lateral canthus, external canthus, till tragus. Along the side, we have possibility to create entry point for any treatment, for our estophil injection with cannula, also for thread, for everything, when we treat these two areas. And I will find and I will hide my entry point near the hairline, not into the hairline because it will be even invisible, but near, outside, in order not to contaminate this area, because it's very difficult to disinfect the hairline. From this side and also from the other side, from external canthus to tragus, this safety line, and we will put here the entry point for our cannula injection. So,
when you expect that it will hurt more because of the scar tissue, can you add more lidocaine or it doesn't have sense?
You know, sometimes I perform first cannula injections. It means I already put some lidocaine. But actually, you can hide the scar, because this scar, look, probably just put some water here, it already not visible more. So I prefer to treat my patient without any anesthesia, at least not injectable anesthesia. But in this case, probably like to put the cream, EMLA, half an hour, 40 minutes before the procedure could be a good idea. So, thank you for the question. And first...
The dilution is the same like for the classic protocol?
Normally, I dilute a little bit less. I mean, instead of 8 ml, I have 6 ml. 6 ml. So now we need to disinfect the area. Yeah, and I put my gloves. We already prepared the solution, so just to not waste our time, and we will use this solution. This one, okay. Oh, and you can see it's a milky solution, no bubble, no deposit in the wall of the vial. It's perfect. Even if I can shake it, we have very homogeneous solution. This is why I love it. Now we will check how this guy is resistant to the pain. I will try without lidocaine. No, just in this way. This is different treatment. So we will see. It depends on the patient. Normally, I have never had any problem. What?
This is
No. Please, 27 gauge needle. This one. So as I said, I use 27 gauge needle. In my case, it's a little bit shorter, but it's okay. And I go directly into the scar. By the way, in this area, no danger at all. But in this area, we have veins. We are very superficial, so we can't create any vascular occlusion because we need to go intradermally. It's impossible to have any vascular structure there. But anyway, by accident, you can hurt vein and create bruising. So try to see, for example, here in this area, she has a big vein. Even if I go intradermal, I will by sure touch it. So I just move a little bit laterally and do in this way. I distend the skin because the atrophic scar is visible even when you distend, stretch the skin. And put a little quantity, look. But you already don't see the scar. The quantity is absolutely, I can't quantificate. Also here. Ask him, please, in his language if he feels any pain.
It's okay.
Okay, great patient. So this is the question. Look, another vein here. I don't go. I go under. When I feel that the scar is a little bit hard, I can subside. I subside it in this way. It's a little bit more painful, like this. Do you see? I subside, and again, I deposit my product. I see how much, and I move. Okay. I carefully try to avoid the vessels. Again, I subside the bottom. Then, you know, if you feel that the product spread behind the scar, just put your finger. You will stop it. Okay?
Like later on, we have to make a massage or
I massage right after the injection, just push a little bit to spread the product. Okay, again here where I feel and I see very depressed scar, I perform multiple subcisions in this area. You can use even bigger needle, like 22, 23 gauge. Okay, I put my finger, I put a little bit of the product, and you see, anyway, we create probably some small bruising here. Just press a little bit and it will stop. Okay, you can please push and I go further. This is more interesting. The bigger we have, the more interesting it is. Go under, subside without any fear, because when you subside, you can't create any problem to our patient. It's better to have more rigid needle in order to do like this, you know, just cut in this way. So you can take bigger needle. Already with subcision we see some result, and then we inject right under, creating kind of small papula. Okay, it's a nice feeling already. Again, in this area we see, is it your boyfriend?
No.
No? No, because you ask him so many times if he's okay. No, he's nice, by the way. Subcision, subcision. In this way. And by the way, you repeat it even the next time, each session you repeat subcision if you need. Sometimes you don't need. No, I will still use it. Okay. And then inject. Okay, we inject here. Very superficially, intradermally, remember. As you can see, with this treatment we have more bruising. Very superficial, not very big bruising, but they are. Thank you.
After how many weeks do you repeat the procedure?
5 to 6.
5 to 6. Thank you.
Welcome. Small papulas, you feel here scar tissue, so I have difficulty to penetrate, and I put small quantity. And again here, it's up to you. Where you see the problem, you put the material. Okay. And I also see here in this way. Okay.
Do you aspirate in any risky region or not at all?
No, when we are intradermally, we don't need to aspirate.
And when you are on the bone, like when you make the balls, like in the
yes, when I use bolus technique, I aspirate where I need. For example, we can talk about this. here I feel how it's hard, the tissue. Even with the needle, it's difficult to penetrate. And you see the tiny quantity of the product I inject. It's not a lot. Okay. And then we go to the other side. Could you press, please, here a little bit? This one requires abscission.
For this type of the scars, you recommend 1 to 3 procedures?
Depends on the answer of the skin. For example, if the patient is a smoker, of course, he will produce less collagen. So you need more sessions. Again, also here. And also here.
If the result will be good, I mean the response of the skin will be good, does it mean that after around 2 years we have to repeat again, or it will stay somehow, I mean, collagen inside? We don't know yet.
No, I have already treated my patient for this point. You know, everything in our organism, even our skeleton, changed totally. The epidermis in 28 days, the skin in some months, and the bone in some years, but anyway, everything changed. So this question, I saw in my patient permanent result, but not at the same level. It worsened. Why it worsened? Because, you know, when you suffer from acne scar, your aging process is different. Because in some patients, the scar tissue allows for the tighter skin. So some of them have later sagging. But exactly. But what could be even worse in this patient, when with sagging they accentuate the not treated atrophic scars. And in this case, and I have one of my patients, she's 64 years old, yesterday I showed you, she had a terrible scars, even worse with aging. But with this treatment, no. So I think it's very useful to treat them anyway. The result will not be permanent, but it will last and something will remain forever. Of course, we have to remember, we go to the hairdresser every 2-3 months, so we should remember to go to our doctor sometimes, every 2-3 years at least.
Irina, have you any experience with the treatment of Improscar?
Proscar?
Improscar is the silicone stick, and in combination with the laser CO2, it's good for atrophic and hypertrophic.
You mean Proscar like plaster putting in the...
Silicone stick is the new one from
no.
Sweden.
I don't have this experience, I'm sorry. Yes, but I have experience with the laser treatment, which have its limits, because the laser mostly create improvement on the surface, but can't remodel a lot the dermis. Of course, fractional laser could improve some dermis structure, but not a lot. Not a lot. So the combination of Estefil and laser could be really winning solution for these patients.
So first laser, then...
No, exactly the opposite. Exactly the opposite. Because when you perform laser treatment in such patients, you can also work over the border of their scars. So with our treatment, we can lift the bottom of the scar, but we still could have some border evident, okay? So in these cases, laser can treat this border in ablative mode. Okay, so in this part we have very few.
What should be the break between Estafil and the laser?
The period.
How long should we wait?
Okay, I prefer to wait the final result of Estafil before performing laser, and normally 1 month after the last session. And look also the position of the tip of the needle. Did you notice how I use the tip of the needle? The opening. It's important because you should have it up. Because if you put it down, it's easier that the product will penetrate under the skin. It's not a problem at all, but probably the treatment will be less effective. So, as you can see in this patient, we use only 1 ml of the product.
Shouldn't we wait 2 to 3 months till the collagen will be, the process of stimulation will be finished to see the final result?
Exactly. I go again when I see more problem. Like here, I put my finger to block the diffusion, and I put it under the bottom, even creating some small papilla. Okay, the patient is very good one.
If we use earlier the laser, especially ablative one, for example, after a few weeks or 1 month, can it destroy the
No, absolutely.
polylactic
No. It can't. Because anyway, laser creates stimulation. So I think it's not dangerous at all.
The doctors use heat to destroy some product. That's why I was asking.
No, I explain you. Yes, very good question. We use like radio frequency or some other energy-based devices to correct some side effect. For example, first of them, the most common, the excess of deposit of hyaluronic acid filler, particularly in the temporal area or in other area, under eye area also. So in this case, we destroyed hyaluronic acid, and we just accelerate the metabolism, and hitting a hyaluronic acid, of course, it goes away quicker. But in case of polylactic acid, it's different. The microparticle is not exactly the target of heat. The target of heat in these cases, when the patient was treated with polylactic acid, for example, Estafil, I personally didn't have any side effect of this kind. But if you have some probably nodule, not granuloma, but small nodule, so you hit the area to accelerate the metabolism and to dissolve this nodule, but in natural way, not because you dissolve it with heat, but because you accelerate the collagenase or other process of collagen metabolism. So this is the point. For other products, which other products? If you use agarose-based gel, the same. You can use energy-based devices like radio frequency when you deposit too much. In this case, you accelerate metabolism of agarose and it will dissolve. But in this case, we don't have a real interaction between the microparticles of polylactic acids and heat. Even if I think probably we could even enhance the result. Because
by additional stimulation.
Exactly. Additional stimulation. But if we want to go even further, we think, because we have fibroblasts, no? We have a substance which stimulates these fibroblasts. And what the fibroblasts need to their job? They need food. So if we put inside, for example, amino acids, the cluster which really create collagen molecules, it would be even fantastic treatment. But, you know, we need also to respect the budget of our patient. So, I think I finished the treatment of the scars. Yes. And now we will start with the treatment with cannula. With the cannula. So, as I said, I will create a small entry point following the safety line, which is following lateral canthus till tragus, safe area. I put a tiny quantity, just a small papule of lidocaine in this area, so it will be comfortable for him. Again, the line is still here. I just go inside, some lidocaine, and then I will create an entry point. No, the 18 gauge rose, the pink needle, yes, and then the cannula. Okay. Put the cannula, please. Pinch, so you will avoid to have bleeding right now. Okay. Yep.
So
And
do you think it's better to start with a single needle injections and then do the cannulas? Or?
I explained before that, of course, if we first perform cannula injection, we will create anesthesia here. Okay. It's comfortable for the patient, of course. But in the same time, sometimes I'm afraid about hiding also the scars, because this solution anyway can level the plane and can hidden. Yeah, so it's better. I prefer to treat so in precise way each scar. Now, of course, he is swelling, but actually, if you can see, already improved the aspect of his scars. When we treat the temporal area, it's not dangerous to treat it superficially with this cannula. Oh, I love the male tissue, so strong. No, because it's very positive. So, anyway, it's not dangerous, but the only point could be the bruising. We would like to avoid, because when we have bruising here, it could go down, it create like black eye. So be very delicate, soft. This movement, give me please a clean one. Softly, softly, painful. It means that I'm near the vessel, vein, not nothing of particular. And then just inject again. Why I use always my finger here? For you it's not comfortable because you don't see what I do. But in this way I feel two things. First, the tip of my cannula. And second, the quantity of the product I inject inside. So for me it's more comfortable. But you can see only also in this way, just press, distribute.
And still you have the whole of the cannula up Or done right now? Or
I never mind about the opening of the cannula, but yes, good observation. If you maintain it up, it's okay. But you know, I rotate it,
yes.
so
it's difficult to.
So I go again here. Okay, and then in other group, there are doctors who asked me if I sometimes treat the patient not for scars, of course, but for anti-aging proposals into the hairline, into the hair part of the scalp. I don't do it because I had some experience with some patients who had hair loss due to the pressure of the product on the hair follicles. So I prefer not to do. It is reversible, but who knows? You know, some of our patients, they have a real problem with hair loss. Why create another condition? So now, beautiful skin.
Very healthy.
Yeah. I just inject all over here in this area, just to give the overall support. As you can see, I use, it's hurt a little bit with burning because of sterile water. I said, I use this small syringe, only 1 ml, because you know, I distribute in this way very carefully, in very even way, So I think I will also put some product here because he has a small depression there, just for beautification. Why not? We have the product. He already paid the product, not him, but I mean, in other situations, our patients pay whole vial. And of course, it's up to you. When the patient has a small quantity of the scar, but he wants to have masculinization, the angle, you can put it here. Why not? It will be even the plus for him, another advantage.
In 1 point, not more than 0.25, right?
You mean when I use the cannula?
No, when we use needle.
When we use, in this case, we don't check. We just see the lifting of the bottom level. But when we use deep needle injection technique, I advise you not create better, bigger bolus, because otherwise it's easy to obtain nodule. And as I explained to the previous group, by the way, I will show you also the picture of my patient. I created oppositely the nodule in her face because she has a particular structure of her mandible bone, and I created bolus and nodule to treat this condition. Otherwise, okay, I will finish and then I will show the clinical case and I will explain. You see how it's difficult to treat, to be superficial in his case, because he has a lot of acne scar, also not inside but also out, not also outside but also inside. Beautiful guy. Another one, please. No, we already done here. Yeah, thank you. So just lift and create the entry point, and then we go to the temporal area. Oh, give me please again, because I created probably too superficial. Again, the pink. Thank you. Okay. Et voila.
I have one more question. What about the application of estetol during the breastfeeding period? Do you do that or you don't recommend?
If we think about biochemistry, sure. I start from the point when the woman is pregnant or breastfeeding, I never touch them, just to protect myself. But if you think about biochemistry and the metabolism of polylactic acid, you can understand there is no problem. Because when we dissolve, I mean when the organism metabolizes this product, we obtain only carbon dioxide and water. So what problem for the baby? Is no problem. Give me please a clean gauze compress. Yes, I know it's uncomfortable here. Slowly, we go slowly. Oh, very, very strong tissue. But if you have any obstacle, just stop. You have no obligation to penetrate at any cost, you know. When we use our devices in live patient, we don't need to treat at any cost if you have any difficulty. Like here, change your vector of injection, and that's all. Okay, I think for the temporal area it's okay. The rest of the product we will put into the cheekbone area, because also he has much more scars here. Okay, and we will finish this treatment. No, I already have just the syringe within. Okay. Just put inside more. Okay. Yeah. Oh, voila. A lot of scars, and to overcome this problem, just create a tunnel and go inside. You are able to change the position of cannula, but do it very carefully, because sometimes it's so strong, the tissue, that you can even break. I never seen broken cannula, but I've heard about this from colleagues. We practically finish. We have another one. Yeah. Yes, I put it here. The last one. Yes, exactly, the last one. Okay. Acne scar treatment is interesting because you know, it's not only how are you, huh? It's okay. Okay. Because sometimes, and more frequently, we have young patients who have some problem of auto-steam, because of the scars, and so you help them. They are very happy. Improve their life quality.
Последнее.
To pranění je nepříjemné. To vodu, nebo co to bylo.
Jo.
Et voilà. The last one. Okay. And now we just massage with a cream. We can use antibiotic cream or post-treatment cream, as you prefer, to make more comfortable this treatment for the patient. Okay, just, and do you have this cream? Ah, okay, great. Just I would like to stop this. Here is already okay. Enough. Just, could you please maintain this one? I will massage. Okay. The massage in this case just to distribute a little bit more homogeneous way, but Estefil has natural attitude to spread. But the patient love when we do this treatment. And also here, yes. Et voilà. Remember the pictures. Okay, nice guy. Okay, come here, please. You are a little bit red now, but it's not a problem. When I do this treatment, I also take the picture with 3D photo system in order to evaluate time to time, every treatment, how the scar changes in depth and also in diameter. And actually, it's objectively evident. So he can do everything, no limitation, except just go to the gym for today because of these small entry points. Normally no problem, but you know, in the gym a lot of doting. And anyway, physical activity. So I prefer ask them not to go the day of the treatment. Okay, I would like to show you this case because in our hands we have a beautiful product which could help us to create everything we want in the patient's face. So not only biostimulation, but also beautification with a not big amount of the product, with okay, even only with one vial. This patient, in particular way, if you come here, she has a particular configuration of the jawline because she has kind of hollow here, right here. So you can put even the finger and you feel very big depression. So I injected 0.5 ml here, and look at the improvement. Here it's not jowls. What you see, it's only the depression in this area. So it's not sagging here. So creating the small nodule, I explained to the patient, you will have, if you touch, you will feel nodule. Don't mind, it's normal. And the result, look here.
Amazing.
Really beautiful. So not only skin tightening, but correction of small anatomical particularities, like in this case. But of course, when you will be skillful, I mean, when you have expertise, experience, you can create volume where you want. In this way, you even can avoid to have filler. Of course, filler is quicker, but many patients, they don't want filler. Moreover, in my personal experience, it's safer. it's safer because it's much more difficult to occlude any vascular structure with this kind of suspension instead of the gel. So I work safer, more confident when I use Estafil. Okay? Any questions? Thank you for coming. Thank you. So, question no? Okay. We are, anyway, oh, thank you very much.